Welcome back to Sandra Sells Tells, real estate, real people, real Plymouth. Wherever you are, grab your coffee, take me on your walk, sit back, get comfy, and let's listen and learn together. Today we're talking about something so many families face but don't always know how to navigate. I'm joined by Kim DeLeo from a home care agency known as Elder Care. What makes their approach stand out is that they don't just provide caregivers, they also provide RNs on staff, adding an extra layer of care, guidance, and peace of mind. We're diving into what home care really looks like, when to bring it in, and how it can help people stay safe, supported, and independent in their homes longer. If you have ever wondered when is the right time, this one's for you. Let's get started. Well, hello, Kim, and welcome.
Thank you, Sandra.
Happy to have you here.
Happy to be here.
So let's understand home care and dissect it a little bit. What exactly does home care include?
Well, that's a great question because home care includes a lot. A lot of people think it's just needed when you need total care. But the truth is that sometimes it's more important to have it for companionship. So it can be companionship to total care. Companionship meaning light housekeeping, meal prep, transportation to appointments, medication reminders, and just engagement and socialization. And then direct care is anything from toileting, bathing, dressing, meal prep, any personal hygiene, mobility assistance.
Active daily living, things that we all need, but a little extra hands-on, right?
Hands-on care, yep.
Okay. And how is your agency different, especially with RNs on staff?
Well, what really sets us apart, like you said, is we have RNs and we also have care managers. So the RNs are each client is assigned an RN to their case. So the family has access to a nurse. They also have a care manager who is a concierge liaison that helps support the family and the client more than just a phone call. They do home visits. They'll do supervisory visits of the caregivers.
Oh, that's great. So, And every client gets a care manager.
Every client gets a care manager. We have a licensed social worker on our staff.
That's awesome. I love that. So people are always wondering, like, I don't need help. Mom doesn't need help. But what are the signs that someone might need some help at home?
A lot of times it's just the small things. It could be that mom or dad is a little forgetful, or they're not eating, or they're not drinking, they're secluding themselves, or the bills are piling up. Anything small might be an indicator, or they've had frequent falls or bruises that show up and you don't know where they came from, and they don't want to tell you that they have fallen. So that's always a good indicator. And then, of course, as things they start to decline or their memory declines, that's when you want to really consider private home care.
Okay. And is it better to start small before they become urgent?
Absolutely.
And I think that's I think everybody knows the answer to that, but some people don't. I know they call you in crisis mode, but if they had started maybe small with just a couple hours a week, or 1 or 2 days a week with mom or dad to help them with, their daily activities, they're already there and comfortable with them before something urgent really does happen.
Right. Yeah. It's always best to start small, 2 days a week before it becomes an emergency. And your mom or dad or the client gets to know the caregiver and the agency before more care is needed.
So you kind of touched on this already, but there's a difference between companion care versus hands-on personal care. So companions are different from a home health aide or CNA. Is that correct?
Somewhat, but we have CNAs and home health aides that work for us. We only hire CNAs and home health aides that can do companionship to total care.
Okay.
So depending on where the client is in their needs, they can start with companion and then move into total direct care as maybe their disease process declines. Maybe they have early onset Parkinson's, right? Where they're still independent. They can still do everything for themselves, but getting help in there for that companionship phase where they still feel like they have their independence, but then they're comfortable with the care that they're getting.
Very good. Very good. And then do you guys customize the care plan for each client with that care manager? Who does that, the RN or the care manager? Or do they work together?
It's a combination. It starts with like myself or anybody that's doing the intake. We get to know the family, the client, what their likes and dislikes are, what their wants and their needs are. Some of our clients don't want our caregivers to clean. When our caregivers go in there, they want to clean. So that's part of that process. And then the nurse will do an assessment and the care manager will do an assessment. And they're always assessing and reassessing. I think our nurses reassess at a minimum every 6 weeks.
All right, that's great. And so that kind of touched, I'm going to jump a little bit, that kind of touched on somebody is noticing mom or dad needs a little bit of help at home. Things are just falling behind, whether it's laundry piling up, not eating, things like that. They give you guys a call. And then you're their first contact to go and assess kind of what you just said, like what exactly are the needs and wants that this family expects.
Yep. So I'll assess. We'll obviously do it over the phone initially, but anytime we can meet the family in person, that's when we really want to go because we can lay eyes on the family, the home, the setup. We can make recommendations ahead of time. And, maybe they need grab bars. Maybe there's scatter rugs around. Maybe they've been falling and tripping. So, so definitely that's the first step. And then that intake is pretty involved. And then the nurse will go and do the assessment with the care manager.
Very good. Very good. All right. So the care manager, the RN work together and oversee the aides. Does every client have that RN or just the ones that are really getting to that need that they need them? So like how involved is that RN in each case or is it case by case?
A lot of it's case by case, but there's always an RN assigned. If it is a true companion case where it's really an home health aide is needed, the care manager may do the initial assessment to get it started, and then the RN will do a visit the week after.
Okay.
So yes, every client does have an RN assigned, regardless of their level of care.
So every family has a nurse involved on their case that kind of oversees it?
Yes, every family, every client has a nurse that oversees the client and addresses any care needs, any changes, will reassess as needed, and do that as often as they need to have it done.
That's great. And who's the communicator between the families?
The primary communicator will be the care manager. They really get involved. They'll send the schedule. They'll send updates. They'll communicate with the assisted living if that's where their home is. So they are the primary communicators. The nurse will also communicate if it's a medical need and a medical necessity, but the care manager really plays that strong role.
Okay, excellent. So you mentioned something about if home is in the assisted living. So does that mean you guys can help them wherever home may be?
Wherever home may be.
So might still living, be in their own home, assisted living, their
memory care, children's homes.
Okay.
Sometimes we'll do one-to-one at a hospital if we have somebody that just they're in the hospital, they're on caseload, or they're not on caseload and they need one-to-one, we'll get called in for that occasionally.
Okay. So that's good to know. You can go anywhere. And how do you feel home care helps people age in place longer?
It's so much better to stay home.
Yeah.
Everybody wants to live at home for as long as they can and for as long as it's safe to do so and it's affordable.
All right. Let's talk about that cost and logistics. How is home care typically paid for?
It's paid for privately, but long-term care insurance will supplement. So if you have long-term care insurance, we'll help manage that for you and send in the invoices, the care notes, and what happens with the long-term care is you pay for the care and then long-term care reimburses you for that.
And you guys just said that you help with that paperwork because that's always the biggest pain, people that have to fill out all the paperwork for any insurance.
Yes.
But doing that, so you guys help them with that if they do have long-term care insurance and they utilize that. So that's that or private pay. What about, I've heard about VA aid and attendance benefit. Does that cover home care costs?
Yes, it does. And we are a provider for VA, for the VA, so we can take veterans who are able to get that benefit. So VA will pay us directly for those
That's awesome.
hours. Yep.
So when you first go and do the assessment, I imagine that you kind of help families navigate the options or create the plan for like, how are we going to do this? How are we going to pay? Because I know that home care is not inexpensive.
Correct.
It costs money to keep them safe and keep us safe at home and going and manage. So you guys kind of help put that plan in place for them and see what other options they can. Like, do you have the long-term care? Because I'm
Right. Yeah. We ask those questions because sometimes family, they know and sometimes they don't know, especially if it's a child that's calling for a parent.
right.
They may not know that they have long-term care. So that's the first question. Are they a veteran? Do they receive benefits that they do have to pay privately? The cost of that, the reality of that, that's a real discussion and sometimes a reality check. And occasionally it's outside their budget and maybe creative options might be more appropriate. Maybe adult day health or maybe going to the Council on Aging for a few hours a day will help supplement the respite that the caregiver and the family needs. So we really try to do that. And if private home care is not the most appropriate, cost-effective way to go, there's other programs out there if you're on Mass Health or Medicaid. So we do provide that information too.
Oh, that's great. So you don't just go in there like, nope, we're taking you on service, right? You find the best solution and the best option for them at that time. And you're aware you have a little network of what other programs might be available to be able to help them. So that's great because so many people have no idea. You just get the call, crisis mode, and mom needs help, dad needs help. What are we going to do? So that's good.
It's very difficult.
So how do families handle the resistance of a parent that says, I don't need help?
You try to change the language. Try to change it so you're not saying, Mom, you need to bring help in. Mom, how about some support so that you can have a break, especially if mom is the primary caregiver for dad or vice versa, right? It's also a respite for that caregiver who might need that extra support. So it's often twofold.
Yeah.
So we're helping the client who needs the services, whether it's companionship or direct care. So many times we have clients with progressive neuromuscular diseases and the Parkinson's, Lou Gehrig's, dementia, Alzheimer's, and the husband and wife have been taking care of them 24/7. It's just, let's come in 2 days, 6 hours, see how it works, see how it feels. Give yourself a break.
Right. So it's just as important for that caregiver. And often we don't. The loved ones, we want to take care of our loved one. We feel like they only trust us and want to be with us. And it's hard to let go of letting somebody else come in. But I know that giving that type of extra support and that break is, we all need it. Everybody needs it.
Everybody needs it. A lot of it's the fear of losing independence or control.
Yes.
Or being the caretaker, right? We all like to take care of somebody else, but we have to take care of ourselves first.
100%. So what's your advice for starting that conversation if there is resistance?
I would say just rip the Band-Aid off and just say, how can we help you? What would you like? What would you see in bringing in support? What does that look like? Because what it looks like for me might look different for that individual. For example, my mom, my own mom, like what would be helpful for you? Knowing that you need a little extra support so that you can maintain your independence. So sometimes changing the script helps the conversation.
That's great. That's great. What is one mistake you see families make when it comes to home care?
They wait too long.
The dreaded wait.
The dreaded wait, that panic call on a Friday afternoon. I need help now.
Yeah.
Or just, they just don't know. That you don't know what you don't know. So asking the questions and finding out.
How do they find out? So you want people to do this sooner rather than later, right? We don't want that panic call. So how do people find out about you?
I would just call, just call and inquire. They can call me directly.
All right. So if they were going to call you directly, how does a family reach you?
They can call 774-772-4751.
Okay, say that again in case they weren't writing it down, please.
774-772-4751.
Excellent. And is there a website? What is your company's website?
eldercarehc.com.
eldercarehc.com. So look it up, see all that they offer. And here's another question. What is your territory? Where do you guys service?
We cover a lot of Massachusetts right now. So we cover all of the Cape
Okay.
down to Orleans pretty comfortably.
Okay.
Plymouth County, South Shore, Metro West, getting into Boston and growing from there.
Wow. So you guys are all over and you have aides and managers and RNs that go in all of those different areas. Couple other quick questions for you here. So do they get the same aide every time? Somebody has somebody 3 times a week. Is it the same aide?
It could be,
Okay.
but the reality is it's probably not going to be because caregivers call out. So we do try very hard for consistency because that's very, very important to the family. It's very important to the client.
Oh, yeah.
Consistency, quality of care, that's really high on our priority list. The longer shifts are easier
Yep.
to make that happen.
So let's talk about shifts. What's your minimum?
Our minimum is comfortably 6 hours a day. We will
All
do
right.
4 hours a day, but I have to be honest, those are difficult shifts for quality and consistency of caregivers just
Okay.
across the board.
So most aides don't want to just go for 4 hours to a client. They want to go for longer. So that's why you try to have somebody have 6 hours a day. But if somebody's just starting out, is really resistance to the home care.
We'll do whatever the family needs at that
Because,
moment.
They're like
Yep.
6 hours seems like an eternity.
It does.
If they don't even want somebody to come for like 1 hour.
It does.
So,
It does seem like an eternity, but understanding what you get versus what you don't get is really important.
Right.
Yeah, that's a common theme
oh, I'm sure.
across the board.
I'm
you know,
sure.
we all
Yeah.
want to start slow, and we're happy to do that. We just are very honest with letting the families know that consistency could be a challenge if caregivers call out.
So they do, but I'm assuming that, you know, and with that many people that you serve in that territory, you have people all over, so you have a lot of aides on staff. However, you're starting a new case. You're like, okay, Susie, I want you to do Joe Schmo Monday, Wednesday, Friday this time. And you put her into that, right? So
Absolutely, yes.
it's just not, it's going to be a different caregiver if she got sick or something came up,
Correct.
right?
Yeah, it would not be
It's
a
not
revolving
consistent.
door of different caregivers. It just might
and that's
be
what
one
I
or
wanted
two.
to
Yeah.
clarify because I just don't want people to get confused. Like, I don't want a different face every day because
No, nobody
it's
wants
very
a different face.
hard for them to allow somebody new to come in. And then once they meet someone, they have that trust. And so I know it's hard for them to like, well, who's this? I don't know her or him. And do you have both males, females on your staff?
We do. We
Some
have
people
both males and females. We
Right.
don't. There's not a whole lot of males that
Yep.
are private home care caregivers, but we do have some, and we will utilize them if a family is requesting, especially if it's a male client.
Yeah, because
We wouldn't-
some families are different. You know, having done a little bit of worked for a home care agency before in my past, I know that some people just prefer that or certain types. So that's good. And what type of training do your aides go through?
They go through an extensive onboarding with our team, and they come into the office, and they all have to be a CNA or home health aide. So they have to have some sort of certification.
Okay.
And then there's ongoing training that happens. We have a compliance nurse that's based out of New York.
I love that. That's
Yeah.
great.
So there's
Good.
ongoing training. The care manager will work with, and the nurse will work with the caregiver. We do supervisory visits unannounced to the caregivers
Excellent.
and give them feedback, both positive and constructive feedback on how they did a great job with a client or, hey, how about this approach? This might be better, type of thing.
Very good. I like that. So your aides are qualified, and then they have to continue with the training so that they stay, educated
Yeah.
and what can help them. And that's great to know that you guys do that and that you even do unsupervised visits because you never know what's going on.
right.
You know, Your aides are your front line. So you can be out here selling it, but your aides are your front line and they're in the home and doing, taking care of the client. And you want to make sure it's what you're selling, what you're telling people.
You're as good as your worst client, your worst caregiver.
Yeah. So.
Yeah. And if a caregiver isn't a good fit, we're really good about making sure that we find one that's a better fit for that client.
Even better. So I'm assuming in your assessment that you try to think of a good match.
Oh, yeah.
Right? Most
Absolutely.
of your aides, and you'll be like, all right, this aide would be a good match for this person, right? Because you want to match
Correct.
personalities
and different dynamics. Or
yep.
Is there an animal in the house? Is there smoking in the home? There's
Right.
all those kind of factors that we have to consider as well.
That's great. Awesome. Lots of good information. And so again, it's elder care. They can find you online. Where is your office?
Our home office is in Plymouth, 15 Richards Road.
All right. 15 Richards Road in Plymouth is where their home office is, but they cover all the way down to Orleans and all up into Boston. So if you or a loved one is considering that they might need some extra help at home, I would definitely reach out to them. Now, Kim, every time I end my podcast, I end with a key of the week based on kind of what we're talking about. And I never know which way our conversation is going to go. But this week, I have, as your key of the week, start support before you need it.
Yes.
So that is everybody's key of the week. Start support before you need it. Bringing in help early, even just a few hours a week, can build trust, ease transitions, and prevent bigger issues down the road. It's not about losing independence. It's about keeping it longer. This has been super helpful, Kim. Thank you for being here and breaking this down in a way that makes it feel a little less overwhelming. If you or someone you love is starting to need a little extra support at home, just know that you have options. You don't have to figure it all out alone. And as always, if housing or real estate plays a role in that next step, I'm here to help you guide you through it. Thanks for tuning in to Sandra Sells Tells. Be sure to like, follow, and share this episode with someone who might need it. I'll see you next time.